In preparation for your prostatectomy, it's a good idea to gain full awareness of your pelvic floor preoperatively. In fact, participating in pre-prostatectomy pelvic floor exercises makes you 25 times more likely to regain continence within 3 months after surgery compared to those who do not. That's according to a study published in Journal of Urology. Additionally, a meta-analysis published in European Urology revealed that preoperative pelvic floor therapy reduces the risk of erectile dysfunction by 30%. So with that, I wanted to get you started with pelvic floor exercises. Pelvic floor is a group of muscles that, if you look internally, you're going to see this little bit of a hammock. Externally, you can see it's the foundation for other external organs. What you're going to do is contract that muscle, and in a series of contractions and relaxations, you're going to build strength and awareness. I find the best cue for this exercise is for men to think about pulling testicles up towards their heads. An easier way of saying this is saying nuts to guts. So when you are pulling the nuts into your guts, you are contracting the muscle. A nice way of providing yourself some feedback, if you are wondering if you're contracting the right muscles, is using your fingertips. So you're going to sit on your hand with your fingertips on your midline. I'm going to model this for you. And so when you're in that position, you will then think nuts to guts, therefore contracting the muscle, and then relaxing the muscle. And after a few repetitions, you should feel the sensation on your fingers of tightening and relaxation of that area. When you are doing these exercises, I would recommend holding that nuts to guts position for 5 seconds and resting it for 10 seconds. That's an easy amount of time to watch on a clock with a second hand, and doing that for 30 repetitions a day. I would also recommend doing that for 2 to 4 weeks prior to your surgery in an effort to build strength and awareness of that pelvic floor. And then once you are done with your surgery, you will really be able to hit the ground running. Of course, if you are having a difficult time asserting if you're contracting the right muscles, then I would highly recommend considering pelvic floor physical therapy. We here at Physical Rock Women specialize in pelvic floor therapy and are happy to help. So please reach out if you have any more questions. Thanks.